Hello, everyone, and thank you for watching our presentation on cancer survivorship. Our subject matter experts are Dr. Karen Singer of New York City Health and Hospitals and Stacy Corcoran of Memorial Sloan Kettering Cancer Center. My name is Ashley Taylor, and I will be presenting with my partner Janet Chung. We are both students at the City University of New York's Graduate School of Public Health, and we hope you find this video today informative. What is cancer survivorship? According to the National Cancer Institute, an individual is considered a cancer survivor from the time they are diagnosed until end of life. Survivors include both those living with and without cancer. According to the CDC, cancer survivorship care plans are records of a patient's treatment history, as well as any checkups and follow-up tests in which they will need in the future. It may also explain possible long-term effects, treatments, and plans for healthy living individualized to the patient. Because cancerous tumor cells can return and or travel to other places in the body, it is important that cancer survivors develop and update their cancer survivorship care plans with their primary care provider. Primary care providers should also expect that any other recommended specialist in which they recommend patients to see will also do the same. By developing and updating survivorship care plans, providers can ensure a holistic health and wellness approach is considered for the patient during diagnosis, treatment, and or post-treatment for survivors. What primary care providers should know about cancer survivors today. The number of cancer survivors is growing dramatically with the aging of the baby boomer populations. Cancer survivors face physical, psychosocial, and practical impacts when they are faced with cancer and go through treatment. Emphasis on long-term follow-up care for cancer survivors is important in order to improve overall quality of life and health outcomes. Primary care providers play one of the most critical roles in clinical follow-up care, and they should always check to update and develop cancer survivorship plans when treating cancer survivor patients. The four components of cancer survivorship care. The four essential components that are necessary to pay attention to when developing and discussing cancer survivorship care plans with patients are care coordination, assessment and management of physical and psychosocial impact, health promotion, and surveillance and screening. Care coordination. Primary care providers should review treatment summaries and survivorship care plans in order to address any physical and or psychosocial effects so that patients can be referred out to necessary specialists for care. They should encourage the inclusion of caregivers and loved ones to be abreast of the patient's survivorship care plans in order to ensure the patient follows through. And they should ensure the patient's family history is up to date as well as advise genetic screenings as necessary based on the type of cancer in which the patient may have or once had. Some tips for providing care coordination. Providing care coordination is a critical function of follow-up care due to the fact that cancer can return after treatment. Medical charts and family history should be updated at each visit. Providers and survivors should also work together to update their cancer survivorship care plans. And providers should provide patients with recommended referrals as suggested in order to provide a positive impact on the patient's overall health. Assessment and management of physical and psychosocial impact. Providers should follow tumor-specific guidelines from the American Cancer Society based on cancer type in order to assess the preparedness of survivors for their transition from active treatment to community care settings again. Addressing any symptoms and or mental health issues is important in order to determine which outside specialists care survivors will need in order to better manage comorbid conditions. Some tips for assessment and management of physical and psychosocial impacts include, but are not limited to, referring survivors to prehabilitation and rehabilitation specialists for them to properly work with them on their physical issues, referring survivors to behavioral and cognitive specialists in order for psychosocial, cognitive, and or emotional dysfunction diagnosis to be addressed, as some treatments can lead to mental alterations, and also encouraging survivors to join community-based and peer support programs are ways to help survivors manage physical and psychosocial impacts.
Health promotion. The continuum of cancer care survivorship includes treatment and recovery. Some individuals may be living for a long time disease free or living with the disease stable, while others are living with cancer at an advanced stage. It is important to note that individuals in each of these phases have unique challenges with nutrition and physical activity. Challenges can be addressed in the following ways. 1. Primary care providers are encouraged to follow the American Cancer Society guidelines on encouraging nutrition and physical activity for survivors. Encourage cancer survivors to achieve and maintain a healthy weight. If overweight or obese, limit consumption of high calorie foods and beverages and increase physical activity to promote weight loss. Achieve a dietary pattern that is high in vegetable, a variety of dark green, red, and orange vegetables, fiber rich legumes, as in beans and peas, and others, fruits, especially whole fruits in a variety of colors, and whole grains. Encourage cancer survivors to avoid inactivity and return to normal daily activities as soon as possible following diagnosis and to engage in a regular physical activity. Current research shows that fewer than 10% of cancer survivors will be active during their primary treatment, and only about 20 to 30% will be active after they recover from treatments. Such behavior requires support and is encouraged as physical activity at all levels. Counsel survivors to aim to exercise for at least 150 minutes per week and include strength training exercises at least 2 days per week. 2. Assess for the use of tobacco and offer or refer survivors to cessation counseling and source resources and counsel survivors to avoid tobacco products. Counsel survivors to avoid or limit alcohol consumption, no more than 1 drink per day for women and no more than 2 drinks per day for men. Tips for health promotion. Providers should encourage survivors to develop a plan that engages in physical activity and healthy lifestyle changes in order to achieve healthy dietary and active living patterns. Primary care providers should inform cancer survivors that if they experience nutrition related challenges, referral to a registered dietitian can be arranged and at a location that is most convenient for them. Primary care providers should encourage survivors and caregivers to also consult the Academy of Nutrition and Dietetics to identify private dietitians within their area. Surveillance and screening. With surveillance and screening, primary providers check for early local or regional cancer reoccurrence. Doing these checks, primary care providers can detect reoccurrence or second primary cancers early. For average risk, asymptomatic individuals follow American Cancer Society guidelines for breast, cervical, colorectal, endometrial, lung, and prostate cancer screening. Individualized clinical follow up care should be provided to survivors based on age, specific diagnosis, and treatment protocol as recommended by the oncology team. Make sure patient receives detailed cancer-related history and physical exam. Educate and counsel about signs and symptoms of local or regional reoccurrence. Assess family history for cancer and offer specific genetic counseling if hereditary risk factors are suspected. Screen for other cancers as you would the general population. Provide annual gynecological assessment for postmenopausal women on selective estrogen receptor modular therapies. Tips for surveillance and screening. Considering patient's age, past medical history, and family history can determine if or when screening is appropriate for a patient. Guidelines and American Cancer Society recommendations. Take control of your health and help reduce risk of cancer by doing the following. Stay away from all forms of tobacco. Aim to attain and maintain a healthy weight and get moving with physical activity. Eat plenty of fruits and vegetables daily. For best health, do not drink alcohol, but if you choose to, limit to no more than 1 drink per day for women and no more than 2 drinks per day for men. It is good to know yourself, your family history, and your risk of getting cancer. Take charge of your health and get regular checkups and cancer screening. American Cancer Society recommendation for breast cancer. Women ages 40 to 44 should be offered the choice to start breast cancer screening with mammograms if they wish to do so. At age 45 to 54, they should get an annual mammogram and switch to every 2 years after age 55. They should be familiar with the benefits and limitations and possible harms that are linked with breast cancer screening. They should also be familiar with their breast and report any changes to a healthcare provider right away. American Cancer Society recommendation for colon and rectal cancer and polyps. For persons with average risk for colorectal cancer, the age for screening was lowered from 50 years to 45 years old. Screening can be done with either a stool based test, which looks for signs of cancer in the stool, or an examination of the colon and the rectum. Regular screening is recommended up to age 85. The actor Chadwick Boseman was 43 years old when he died from colorectal cancer. His death has brought some awareness to the prevalence of colorectal cancer in our society. Finally, any abnormal test result from an alternate screening method should be followed up with a colonoscopy. American Cancer Society recommendation for cervical cancer. Screening for cervical cancer should start at age 25 and up to age 65 with a primary human papillomavirus test, HPV. It is not recommended for persons under age 25 because it is rare in this age group. The test is to be done every 5 years. The test should not be done on persons over age 65 who had normal results for the last 10 years. And persons who received the HPV vaccine should still follow the screening guidelines for their specific age group.
The American Cancer Society recommends that people who are high risk and or are 55 to 74 years in age in fairly good health have quit smoking within the past 15 years, or those who currently smoke, especially having at least a 30-pack or more per year smoking history, are screened yearly for lung cancer. They should speak with their primary care providers about their risk for lung cancer, how they can quit smoking, and the benefits, limits, and harms of lung cancer screening. For prostate cancer, the American Cancer Society suggests that men speak with their primary care provider starting at age 50 about the pros and cons of testing so that they can decide if testing is the right choice for them. African Americans and males who have direct family histories of members who had prostate cancer before the age of 65 should inquire about testing starting at age 45 and will be required to complete blood tests to determine their PSA levels, which will determine how often they should be screened. For endometrial cancer, the American Cancer Society recommends women begin screening at the time they begin menopause. They suggest that all women be made aware of the risks and symptoms of endometrial cancer. They also suggest that women report any unexpected vaginal bleeding or spotting to their doctors. For some women who have a history, it is recommended that yearly endometrial biopsies occur. At Memorial Sloan Kettering Cancer Center, there are currently adult survivorship and adult and pediatric long-term follow-up programs. These programs currently offer comprehensive assistance with emphasis on overall health and wellness, in addition to screening exams to adults and children who have completed treatment. Their long-term follow-up programs focuses on the ongoing medical and psychological concerns that patients may have after treatment. Experts on these teams help patients manage late effects of cancer and or cancer therapies. And for children up to 21, their team consists of physicians, nurses, nutritionists, social workers, neuropsychologists, and psychiatrists who work together for the patient's overall health and care. Memorial Sloan Kettering also provides several resources for primary care providers. Their physician referral services provides easy access for primary care providers to set up their patients with a specialist as needed based on their specific cancer type. Providers can also find current and updated insights on clinical trials, new treatment approaches, and innovations in detecting and treating different cancers. For more information and resources for following up with cancer survivors, please visit the Memorial Sloan Kettering Cancer Center website as well as the Living Beyond Cancer section for cancer survivorship tips. As always, thank you for your time and listening today. And we hope this video encourages you to use the four components of cancer survivorship in order to develop or update a cancer survivorship care plan the next time you work with a cancer survivor patient. Thank you and have a nice day.